I think molecular or genomic testing is one of the most exciting things to happen in oncology. I mean, I know I'm a young oncologist, but it's not hard to look back and over the history of oncology and see that what's happened in the last literally few years has dramatically changed how we practice or how we think about caring for patients. But it is a tremendously complex area. Not only do we struggle with how do we get tissue, who should we test, but then who's going to do the testing? So there are certainly leaders, academic centers in particular, that have helped lead the way in this development, and then there are private entities that are doing this as well. One of these that I think it has been very exciting in terms of setting the bar very high is a group out of Boston by the name of Foundation Medicine. But I do think it's challenging. Can the testing that you're pursuing, can you trust the results? I mean, is it getting you what you want in a comprehensive way? Are you getting all the markers you want to test? And can we believe the results? And is it being done in a timely fashion? Is it affordable? And then ultimately, when you're sitting there with the results in your hand, what are you going to do with that information? If you're in the middle of nowhere, I don't think that testing helps you, because if you don't have an opportunity to pursue what often is an investigational agent, I'm not sure you've achieved or helped anybody by doing an expensive test and having results in front of you that you can't use. But I think if you have an opportunity to travel to a center that has research where identifying marker X or Y or Z can lead you to a trial that has a drug that targets X or Y or Z, I think is the right step forward. We don't know that that is going to lead to responses or cures for patients, but it seems to be a much more rational way of finding a new therapy for a patient than choosing something out of the air that's new, which has really been the tried and true way we think about pursuing experimental therapies after standard therapies have been tried. So I think it's a complex area, and I think my concern right now is there are a lot of centers embarking on this road of doing testing. And I think it's not clear to me who's going to emerge as the centers that do this really well. Can everybody do it in their own backyard? And then, of course, who's going to pay for all this testing? If you test for 250 genes and 249 of those genes are not important, but maybe one of those is, how do you cover the cost of the 249 tests that aren't really going to be helpful? So I think there's real challenges both from a payer, insurance, and government perspective. Also, how we design our research studies. I think this is a real challenge for us. Am I going to have to test 100 people to find one marker? It's hard.